recording is going. Welcome again to Marcia and all our attendees. Thanks for being here.
Thank you for inviting me, Megan. So we're all set to get going?
Yep.
Okay. My name is Marcia Relyea. I am a gerontologist and I work part-time. I'm also semi-retired. My work is with Care of Southeastern Michigan in Macomb County. They do a lot of work in Southeast Michigan, helping people by becoming educated, but also providing support services for people with mental illnesses, substance abuse issues, and other and family problems as well. I'm on board as their person who works with the older population, and I mostly do educational seminars with the older folks and with professionals who do work with them. The title is Help for Older Adults Who Might Have Mental and or Emotional Difficulties During This Period with COVID-19. But just a little bit of information about Care of Southeastern Michigan. And I put this on there because I think the mission statement is valuable to have, because it's very applicable to what we're talking about today and with COVID. The mission of CARE is to strengthen resiliency and people in their communities through prevention, education, and various services that improve the quality of life. And that covers a lot, doesn't it? But that's why you're here today on this webinar as well, is to strengthen your own resiliency and find out maybe a tip or two that you can employ for yourself and for the people around you that might help you as you go through this period of COVID-19 changes. So this webinar is going to cover three main areas, three main boxes, and number one is the importance of identifying who do we mean when we refer to older adults. But it's also helpful to know where they or we are living. I will have several tips for families, caregivers, and older adults to stay connected in order to combat loneliness, stress, and adapt to the various COVID-19 situations. And finally, I have a section on various resources that may help you. First of all, then, who are the older adults? What terminology to use? And this depends on who you are. If you are an older adult, what do you prefer to be called? Do you like to be called a senior citizen? Do you like to be called elderly? No, not usually. Being called an elder can be very respectful. But what kind of terminology, what label, so to speak, do you use? For some people, it doesn't matter at all. For other people, they may have some real hot button names that they can't stand to be called. Another thing to be aware of is in the aging population, everybody's unique and is a very heterogeneous group. So when we talk about who older adults are, we tend to think of a group. But who is this group? And it's a huge group, but it's made up of very different individuals. It's easy, and our brains like to clump things together because it's easier for the brain to work through grouping than it does individuals. But I think it's really, really important when we look at older people to see each one as an individual. We don't want to stereotype, but we tend to do it. We tend to, just part of being human is to stereotype different people, different groups, and so forth. We're doing that a lot today. And so I beg you to think about what stereotyping does that's helpful and what it might be doing that might be not so helpful or even hurtful. So who are the older people as far as ages go? Medicare eligibility starts at 65. Unless you have disabilities, but 65, and a lot of the research into older adult issues usually starts at 65 and goes on up. But a lot of people can be considered in the older adult group at 50 and 55. You can join ARP. I'm not sure if it's 50 or 55 now. You can go to McDonald's and get senior coffee at various ages, but 55 for sure. But a lot of older people are centenarians. They're over 100 years old. So think of the differences just in age between somebody in their 50s, 60s, 70s, 80s, 90s, and the hundreds. Huge differences. So consider that as well when we talk about older adults. We are talking about a lot of differences, but we're clumping them together in a way today because there are some of the similarities and what we want to talk about with with managing ourselves during the COVID. Another thing that really comes out a lot if you get to know older people is their cohort, what year they were born. So in other words, how old is this person today? Are they 70, 80, 90, or somewhere in between? So they were born in a certain era. They were born in a certain place. Are they city people? Are they country people? Are they farmers? Were they born in a different culture, in a different country, and so on? Where you're born and where you grow up has a lot to do with what we think and how we behave today. And culture covers all of these things. So all of this is part of looking at an older adult as a human being, considering how they were born, who their friends were, where did they grow up, what was their life when they grew up, did they have a family, did they work, and where did they work, and all of these kinds of things. And then this gets somebody to where they are today at age 70 or 80 or 90. All of this background is part of that person today, and part of their thinking, and part of what they judge to be right and wrong, what they judge to be ethical, and so forth. Other things to consider with our older adult population, and any population, is their current mental, physical, emotional, and social and financial circumstances. And these can change by the day, they can change by the year, they can change by the law, they can change by various kinds of things. Financial circumstances is very important, so are social circumstances. And a lot of this has to do with how we can manage under COVID. So I'm going to look for a few minutes at people's current living arrangements. During COVID-19, where do you or where do your loved ones live? Are they living in their home by themselves? Are they living in their home with family? Are they living in a senior or other residential facility? And if this facility, is it for independent living? Is it for assisted living? Is it an adult group home? Is it for memory care? Is it for nursing or some other? Or are they living with a relative or a friend or someone else? So all of this will determine to some extent how they or we are able to manage the stresses and the concerns that we have during this COVID period of time in our life. I was going to say this COVID crisis, but I think this is my opinion. I think it was a crisis back in March and April and May when it came down as a crisis level. I think now there's a lot of crises with it, but for many of us, we're living with the results of having been through a crisis, and many of you are still in crisis, but it's a situation and living circumstances and social circumstances that we are living in that are not going to change very much recently. So where do I live, or where does your loved one live? What is your support where you do live? How can you reach out to people? Can you be social where you live? What kind of relationships do our older people have? And these relationships are between myself and my family, or with friends, between caregivers and the elders. If an elder is living in a senior facility or even at home, what is the relationship with the person or people caring for them? What kind of community relationships do they have? Many people who are older have long-term ties with a particular church or churches. And of course, the churches were all closed for a long period of time. And even when the churches have reopened, and some still have not, many elders are not going back to church because of the risks of contracting the virus. So what kind of relationships maybe have been severed to some extent because they are not active in their church? Virtual relationships are like what we have right now, over the internet, with our iPad, with different ways that we can meet with people, but not person to person. So and who is able to participate in these virtual relationships? Because some people are not able to, either because of financial circumstances, because their area is not very friendly to internet services. The web is very intermittent in some areas, and even in Macomb County, North Macomb County has some areas that have very intermittent web services or internet services. So how reliable are virtual relationships? They certainly are better than they used to be, but they're not for everybody, and especially elders with any form of dementia may have some significant problems with iPad and iPhone and virtual relationships. They also have very difficult understanding of why they're locked in their rooms or they're confined to their rooms. So there's all of these kinds of things. So with COVID, all of our relationships are strained. They're all different. And for most of us, they are not physically touchy relationships, and that makes a big difference. So to manage our mental health and our emotional challenges during this time, three main things. One is the importance of managing yourself, doing the best you can to manage your stress, your concerns. And I'll get to something a little bit more about that. But we need to manage ourselves. We're not going to get rid of a lot of what's going on. How can I manage myself to best get through today, this week, this hour, whatever it might be? And self-management relies on a lot of the things that we know for sure that are good for us and so on. But the importance of also helping other people and letting other people help you. This is a big thing to manage our own mental health. If we can reach out and help somebody else, it helps them, but it also helps us to know that we have served somebody else. But we also have to be able to let others help us. Some people I know are very, very good at reaching out and helping others, but they are not good at letting others into their lives or to help them. They say, I don't need your help. I don't need your help. But I think sometimes we do need to allow others to help us, just like others need to allow us to help them. If we don't allow others to help us, then they can't help. And we know that helping each other is very, very important. The other thing is to know what you can do and what you can't do, which leads me to the next slide, which is an old Serenity Prayer. This is part of a prayer that's a lot longer than this, but this helps all of us all the time, I think, because it separates what I can do something about what I can't. So, and if you're an atheist, you can just leave the word God out and say to the universe, grant me the serenity to accept the things I cannot change. Wow, is that big, huh? What things can I not change? And so my serenity will be to accept that. The courage to change the things I can, and that can be hard too. What can I change, and do I have the courage to make these changes? And then the wisdom to know the difference. So it's a huge, huge guideline, I think, for COVID and for day-to-day and hour-to-hour things that all of us can be involved in, because we can beat our heads against the wall trying to change somebody else. And we all know we can't change anybody but ourselves. So that's just kind of one thing. We can't change the weather, but we can put on our raincoats, or we can put on a heavier coat, or we can strip down if it's going to be warm. So the things I cannot change, I need to accept them and have some serenity around that. That's the key thing. Okay, so this is something in this slide, I think Megan has the PowerPoint, and so she can send it out to anybody also, and it will be available on the recording as well. But this slide can save a person's life. I know through one really challenging time for myself and my family was when our oldest daughter had cancer, and she was a single career person, and so her dad and I were the primary caregivers off and on of an adult, very successful person. And that was hard in many, many ways. And, but I must have said this Serenity Prayer some days 20, 25 times just to get through the day. And it works, it works. So, okay, so going from the first part of my topic today on who are us older adults, where do we live? Who are the important people in our lives? What relationships do we have? What relationships can we foster? Can we get better about? What can we do some things about, and what can we let go? So taking care of ourselves. And so some tips and activities for all of us. And I have more here than you need to know, and I have probably many more that you could add in. But we know for all of us, no matter what our station is, what our age is, whether we are sick, whether we have even some pretty serious dementia, these three bullet points are things that everybody can enjoy. Everybody can enjoy music. Everybody can enjoy things that are rhythmic, and anything related to the arts. Okay, all of the arts. So going back to music, for yourself, what's your favorite type of music? Don't pretend that I can love acid rock or something like that if I can't stand it. Don't pretend that I really enjoy classical if I never did and I don't. So what's my favorite music? And if you're with somebody else, what is their favorite music? If it's somebody that you know who has dementia, cognitive problems, memory problems, think about what their favorite music might have been when they were younger. Maybe you already know. What are some of your family favorites as far as music goes? What can kind of get you up and going? What kind of music relaxes you? And it's going to be different for everybody. You don't want a piece of music as you're going to bed at night that's going to kind of rev you up and get you going, like a John Philip Sousa march or something like that, that one of our radio stations, WRCJ, plays every morning at 7:15. They do a Sousa alarm, and it's about 2.5, 3 minutes, and you can get up out of bed and march for 2.5, 3 minutes, and it gets you going. That's not what you want at night, but it is kind of helpful in the morning. So anything that gets you going. So always, as part of your self-management, and you're helping others to manage themselves, think about music. Think about putting it on your phone. Think about Alexa, which I don't have, and I don't know how to do it. But anyway, that's something that I think I need to invest in. The old-fashioned CD players, and a lot of older people will still put a CD in a CD player and play their favorite music. So tag into that. For us older people, music engenders many memories. So that can be something to say, what kind of music did you like back in the 40s, 50s, 60s, whenever it was? And they might not remember. Well, maybe you could go online and find a couple pieces and play them and see what that brings up. But I also know from working with older people for quite a long time that almost everybody who is of advanced ages respond to patriotic music. So God Bless America, America the Beautiful, anything, some of the marches, some of, and if you have Canadians living with you, there's some of the Canadian music that you can easily get to. And, what is the French national anthem? Oh, da 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 da.
La Marseillaise.
Thank you, the La Marseillaise. We can get all of those too. So if you have somebody living with you that immigrated from another country, you can find some of the music from their country of origin. Know always that no matter how old a person is, how much pain they might be in, how serious is their dementia, music can always be helpful. Tunes and lyrics are embedded in long-term memory. So if you have somebody who can't remember or doesn't respond to music, put something in from the 40s or 50s when they were younger, or the 60s when they were younger. And very possibly, if it was something they knew well then, they'll pipe right in and sing it. But also be prepared, because memories can be happy memories, they can be sad memories, they can be memories of frustration. I've worked in the field of substance abuse for a long time too, and I know for some people who are in recovery from drugs and or alcohol, some music engenders some old drinking days, and that might not be a very good thing to bring up as during COVID. So sometimes you want to think about things like that too. Anything rhythmic is usually enjoyed by people, and it can be with music. Almost all music is 2/4, 4/4, 6/8, 3/4 times. So it's a good hand clapping, toe tapping kinds of things to be doing as well. But then anything rhythmic is enjoyed. Remember the old games where you go clap, 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 clap with other clap, 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 clap. I've seen people do that. Kids will go to a nursing home with grandma or great grandma, and grandma's at the window, and the kids are at the window, and they'll do the clap, clap, bang, bang against the window with grandma, and everybody's laughing. So clap, clap, bang, bang, and sometimes you go down to lap, 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 clap, clap, touch, touch, clap, clap. And these kinds of things, again, they're rhythmic and they're fun, and they get you laughing a little bit too. Other tips are anything related to the arts, and this doesn't have to be fancy arts or anything. You can get the crayons out. There are very sophisticated, I think difficult, coloring books now that that a lot of older people enjoy doing with the colored pencils, very fine-tuned. And I've seen some people do these, and they're as good as any fine art. But for some people, just a child's coloring book with regular crayons can be just very relaxing and enjoyable. Coffee table books are always kind of enjoyable too. You can see to it that someone gets books with a lot of pictures in it, whether they're artistic pictures or landscape pictures or travel books or state parks or national park books. These can be very enjoyable to everybody of all ages, but I think especially elders who are stuck in their homes and stuck in their rooms, because the book is something they can handle and they can flip the pages in their own time. And the Clinton-Macomb Library is now open, folks. You can go and pick up some of these books and take them home. And again, when we're really, really busy, we a lot of times don't have time for those kinds of books, but now we might. And if we do, they can be very pleasant and enjoyable. Various websites. I know the DIA has a very active website, and I haven't gone on for a little while, but remember when the DIA had Thursday afternoons for older people? And I know buses went from the Clinton Township Library, they went from the Clinton Township Senior Center and churches and all kinds of places. And we would go down there and enjoy a Thursday afternoon at the DIA. Well, I think that I didn't check it before I started today. I think that they still will do a web program for seniors at 1 o'clock on Thursdays. But if you're curious about that, go into the DIA website and see what they are offering as far as live programs and also some of the recorded ones. Are you going to say something on that, Megan? No?
Sorry, I muted myself. I'm going to double check right now and I will see what I find out.
Thank you. Thanks,
Yep.
That's great. Of course, all kinds of photographs are good and other things. So for everybody to manage yourself, and this doesn't mean you're not going to have issues with COVID and being sick and worries and all that, but to manage yourself, think about a time out to enjoy music, thinking about time out to maybe march around the room a little bit, think about opening up a book full of pictures, grabbing a family album from the shelves that you've stored it in, or if you stored a lot of pictures in a shoebox, think about getting that shoebox up and going through it and seeing what's what. This is part of self-management. It doesn't end our angst and so on, but it can calm us for a period of time and bring us some laughs and bring us some smiles. Exercise. I don't know of a better word for that because the word exercise sometimes is a turnoff. It's important to move whoever you are, whatever station in life you are. If you are wheelchair bound, there are all kinds of programs and exercises for the upper body or to do in a wheelchair. If you're listening to music and can't march around or walk around, you can tap your toes. You can do some different things if you can. So do what you can. Somebody said this was a young mother with 2 young children and she never had time to exercise. And her doctor says, well, do you watch any TV? And she had a favorite show she watched every day. I don't remember. And he said, I recommend that whenever a TV commercial comes on, you stand up and you march in place just during the TV commercial. And when it's over, you can sit back down and relax. And she got kind of hooked on doing this. And it wasn't too long ago, but she was going outside and walking for 30 minutes. So sometimes we have to break our pattern of not moving by moving just for 1 or 2 or 3 minutes at a time. And so that's just something it's a tip because it's real easy to stay in our lounge chair or on the sofa. So it's important to move, and it's important maybe to get a buddy to move with you. Moving with music is fun and more inspiring. There's a lot of virtual streaming exercise classes now. The Clinton Township Senior Center has a whole bunch of exercise classes, some outdoors at the Senior Center, some are on your local television, and some are being streamed through Zoom or on Facebook from it. So, and I think that other senior centers are doing the same thing. So it's just a way to kind of make sure that you do get some exercise. And we all know if we do something like that with a buddy, we're more likely to do it. So that's a little bit on exercise. The most important thing is to move. in whatever way you can. And if you can get your heartbeat up somewhat, that's a good thing too. And so I will, just one way to get your heartbeat up is also to do things above your heart, like this. So if you're walking and you do this for even 10 or 15 seconds, it will provide more benefits to you. And you'll feel better also for being able to do that. So that's just another thought on that. I think I mentioned before, use the technology you have available, the different phones, tablets, computers, other kinds of technology, because it's there for us now. And if you need help with it, there's help at the Clinton-Macomb Library. There's help to be able to navigate through some of these things too. And for people who have a basis in a religion or any kind, we all have some spiritual nature. What is your history with that? And I'm thinking specifically of many older people do have a history in a church or with churches or with a specific religion. Use that now to give you peace. If reading the Bible gives you confidence, make sure you do it. Saying the rosary, working with prayer beads. Sometimes I find I have a very, very smooth stone that I put in my pocket sometimes that I got on a beach in California. And I put it in my pocket and I just rub it between my fingers and do that for 30 seconds and my shoulders come down and I tend to relax. So that's more of a probably spiritual than religious, but it's something that is very relaxing, and I can even take myself back to that beach and think about it a little bit, which is always helpful too. And a spiritual nature is not necessarily religious, and I'm speaking to people that may be agnostic or atheistic as far as is there really a God, and I just would speak, where do you find peace? Where do you find some energy, both peace and energy? And almost everybody can say outdoors. Almost everybody can say, in the park or walking a trail or at the lake or something like that. And I'm remembering a story I heard from somebody who was an activities director at a senior living place specifically for people with dementia. And this is in another part of the state, but she said everybody in the home was Catholic or was Christian except for two men who were atheists. And so all of the practices that everybody else did there not only wasn't relevant to them, but made them very anxious. And so the activities director talked to these men's families and found out some of the things that the gentleman used to like to do. And they found out this one man used to love to fish, especially in the wild rivers out west. He would cast the line and fly fish. And so she went out and got some, what we might call coffee table books or pictures of these wild streams and people fly fishing. And he took that book and he wouldn't let anybody else have it again. He just held it to his chest and he would look at those pictures and he would be calm and happy in a way that they had not seen him for a couple of years. And so there's a way that we can reach sometimes into people and find something that will be calming to them. And so sometimes it takes quite a bit of investigation to do that. So I just recommend it and to try different things as well. Okay, is there anybody on the chat who had any other thoughts or recommendations, Megan?
I didn't hear from anyone else in the chat. I did put a few notes in the chat, including the DIA is doing things for seniors. So I put that link in the chat if you want to take a look. I'll also mention in terms of exercise and being outdoors, we have a poetry walk at the Clinton Township Tomlinson Arboretum that's up through the end of this weekend. So it's been up since May. And so there are poems that are placed throughout the Arboretum, which there's a gravel path that starts almost right across from the main branch of the library. So you could get a little exercise in and a little art while you enjoy these poems that mostly relate to nature. We check out music, we check out coloring books. So if you feel like you need a little help getting started with any of these tips, come on in, or we now have a library by mail program where we can mail things to your home if you don't have transportation, or if you are not comfortable coming out, or maybe you're in a group setting where you used to be able to come to the library, but now those buses are no longer running. So you can call the library and ask about library by mail.
Oh, that is so good to know. It's like the olden days when libraries did deliver. They stopped for a while, and now we're back at it. Well, that is so good to know, because I think people that can't get out say, well, what can I do about that now? So call the library. And if you don't have a card, I know there's a way to get that too. So
yep, we'll help you get set up with a card.
Good. Thanks for that. And that poetry walk, okay, it's through this weekend?
Yes.
Okay, I knew it was there. And you know that Arboretum is one of the, it's kind of, a lot of people don't know about it.
Exactly, it's sort of a hidden treasure.
It's a hidden treasure, and we need to open it up. So one entrance is right there off Romeo Plank, right across from the library, so you can park at the library. But then there's another entrance off of, is it 18 Mile Road?
Yep, right where 18 Mile dead ends. So you take
So
18 Mile east from Garfield, and then it dead ends. There's a small parking area, and you're right there where there's a lot of flowers and poetry.
Yeah. It's a great walk. And so, and thank you for the deadline. I thought maybe it had ended, because I had been on part of the walk, but I hadn't been on the one by closer to Garfield, where there's a lot more poems than there is the other part of the walk.
Yeah.
So I want to go back and do it again. So, and we've got beautiful weather today and tomorrow and the next day. And so it's a good time to do that. So thanks for all of that, Megan. And what did you say about the DIA?
They are doing events from home, some specifically for seniors, and I put that link in the chat.
Oh, fantastic. Good. Thank you. I think my mind was somewhere else when you were saying that.
Oh.
Okay. Yeah. Okay, so the last part that I want to talk about are resources. And before on the slides, 1, 2, 3 are resources that maybe many of you already know. However, the first place to call for any questions on aging in our whole area, the 7 county areas, is the Area Agency on Aging 1B. It's like first stop shopping, and they are manning the phones Monday through Friday from 8 to 5, and all kinds of resources. So any questions you have related to seniors, caregiving, and people with disabilities. And they have continual updates during COVID-19. So Area Agency on Aging is a good place to start if you're looking for anything. ARC, of course, is national, and they've got a very, very comprehensive website with all kinds of information, activities, and also COVID-19 updates. Probably everybody on this call is a member of ARC already, so you know of their availability, but a lot of people don't really know what the Area Agency on Aging 1B or the AAA 1B organization can provide for us. And so this is something, and you can call them, or you can go on their website. And I haven't been on for a couple of weeks, but they also on their website by county, they will have places where there's free food available, what days and what time. So this is an area where you can update those resources as well. And if you yourself or you have a loved one who is exhibiting cognitive problems, memory problems, and this particular time can be very difficult for you and for them, contact the Alzheimer's Association. Again, there's an 800 number, but they also have a very comprehensive website. But they have a lot of information you wouldn't even know is available, and so it's a good site to go on and become familiar with as well. And just an FYI, because I get this question a lot as I'm doing programs in the community and also on the web. People will say, well, what's the difference between dementia and Alzheimer's? And so that hasn't come up in the chat, but I'm going to very briefly cover that, I think, because you might think, well, I don't know if Alzheimer's Association is something I want to talk to, but if you're concerned about dementia, dementia itself is a cluster of symptoms. It's not a disease by itself. And I like to compare the word dementia with the word pain. Pain is a symptom or a cluster of symptoms. You hurt, you're in pain, you want to get rid of the pain. Well, the doctor will want to know what's causing the pain. You'll want to know what's causing the pain. You know, you can put a topical patch on it to cover the pain a little bit, but if you don't treat the underlying cause of the pain will come back. So pain is a symptom of something else, of something that's gone wrong. Dementia is sort of like the word pain in a way. Dementia is the symptoms of diseases that will cause the symptoms. The symptoms of dementia are always brain related, so they're cognitive, they influence our way of thinking, they influence our memory. Almost all dementia has memory problems and has cognitive problems. And it depends on where in the brain the disease is attacking as to exactly what symptoms of dementia a person has. But the most common disease that causes dementia symptoms is Alzheimer's. Okay, so a lot of times those two words are used interchangeably. They shouldn't be, because again, dementia is or are the symptoms that will prove that there's an underlying disease, brain disease, that are causing the symptoms. So Alzheimer's is the most common, but it's also, dementia symptoms also occur in people who've had stroke. So the damage in the brain from stroke that is irretrievable or irreversible, that can cause dementia symptoms. Okay, Lewy body's disease is another disease that can cause dementia symptoms. In about half the people with Parkinson's disease, the Parkinson's disease causes dementia symptoms. Not everybody with Parkinson's do have dementia, but some do. People who have a long history of chronic alcoholism may have dementia symptoms caused by the disease of alcoholism. Sometimes it's hard to differentiate some of the dementia symptoms from clinical depression. And this is a very important diagnostic difference, because clinical depression is treatable and reversible, and dementia that is permanent, like from Alzheimer's, is not reversible. So if you have some dementia symptoms, it's important to find out what's causing them. It might be temporary. You know, this COVID-19, the stress from it might, for many of us, be causing more memory problems than we've ever had. And we think, oh my God, now I'm getting Alzheimer's. Well, it might be, or what it very likely isn't. It may be the stress or the unsettledness from everything that's going on with COVID-19 and the spin-off. You know, the COVID-19 is like the rock that we throw into the pond, and all of the ripples from the rock are the spin-offs from that rock being thrown into the pond. For some people, it's their own illness, but for others, it's illness of others, and the unsettledness and the unemployment and the financial problems and the not being able to hug your grandchildren problems and the worries that come. Those are all a lot of symptoms, but other symptoms can be much more forgetful. I can't think clearly. I open a book and I can't concentrate. And all of these things might be, I shouldn't say just, but because we are dealing with so much that's unknown, and it's causing a lot of anxiety and stress that we might not even be aware of, but some of the symptoms might look a little bit like dementia. Fortunately,
can I jump in with a question in that sense? So let's say you are experiencing some of those symptoms, or let's say you don't think you are, but someone else mentions it to you. You know, how would someone know what is maybe sort of normal and to be expected at this time, and when to seek out help?
Yeah, and that's an excellent question. Unfortunately, doesn't have a real easy answer. However, I would say, with any kind of concern, contact the Alzheimer's Association, because it's a really good place to start with questions that are relatively that are concerned with brain changes, with memory changes, and that's one place. There are and at the Alzheimer's Association, they have like a 10-point checklist to go through, and that's one way to take a look at it, also to go through this 10-point checklist and say, oh, I can check off one and it started 6 months ago or 4 months ago, but none of the others apply. So you would worry less, most likely. But you know, the Alzheimer's Association also has social workers on board, and you could call and ask to speak to somebody also. So that's, and also the area agency on AG1B is another resource for that. But if your questions are specific to brain health, the Alzheimer's Association would be a good place to call, and they can mail out to you, or they can put up on their, and on their website they have a lot of this. But if you want paper, you know, the paper products, they can mail them out to you as well. So that's one way. Your personal physician is also a place to start. They're overwhelmed with so many things, but it's still a good place to start. And there's a, I don't have the number or anything handy, but what is St. John Providence system? Is it Ascension now? Is that what?
Yes, I think
Yeah,
so.
I think it's Ascension. They have two sites, one in Novi and one in Grosse Pointe, that their sole job is to do a thorough assessment of older people with changes. And so the one in Grosse Pointe is called the Wilson Center. And I suspect you could Google that, the Wilson Center, and it's right downtown Grosse Pointe. And I know it was affiliated with St. John Providence. So it's whoever, I think it's Ascension that bought all that out. So that would be a possible good resource also. If you're really concerned, I don't know what they're doing with telehealth now, but it used to be, they will do a thorough assessment that includes medication, it includes social work, it includes a geriatric specialist doctor, it includes physical therapy, occupational therapy. So they do a full assessment of somebody aging with a lot of questions as, you know, what's going on right now. The other thing sometimes to look at is the medication you take, because even if this medication you may have taken for a long time and it hasn't caused problems, it might start to cause some brain changes. So I always suggest to people that they have their doctor take a really good look at the medicines. So I think does that help?
Thank you.
You're welcome. Other resources that I think are can be helpful for different reasons. One is the Dana Foundation and Dana Alliance for Brain Initiatives. As a gerontologist, but I also do not like reading academic things at all. My brain just shuts down. What if it's really academic? I had a heck of a time. In my mid-50s, I went back to school for my master's. I had a horrible time concentrating on real research. I just couldn't focus. You know, I'm a library attendee. I love to get out novels and suspense and all kinds of fiction and that kind of writing, but I could not focus on academic and research writing. Anyway, the Dana Foundation and the Dana Alliance for Brain Initiatives, their whole job is to research brain issues today, but also throughout history. They look at prenatal brain development, early childhood brain development throughout the ages, but they also have a specific area on the older brain, and they do wonderful work. You go on dana.org and go under publications or go under recent writings. They've got all sorts of very, very interesting things. And a lot of the work I do, I have handouts from the Dana organization. So dana.org is a good place to start. It's a pretty big website, but if you just start with current research or you start with publications, sometimes is a good place to start, because you can even download a very brief publication on an issue you might be concerned about, like dementia or Alzheimer's or something as well. But they also have a lot of activities that are in the public domain. So you can go on there and get word search puzzles and other kinds of activities as well. And then, of course, the CDC, Centers for Disease Control and Prevention. There is a specific older adult section that we can click on and find out what's going on there. CDC is getting a lot of publicity these days, and most of it's helpful. Okay, so other resources. So I don't forget, I didn't put two books up, but I'm going to hold them up for the camera to see. There are books about managing. The first one is An Anatomy of an Illness. It's an old book. I want to say it was published, I'm going to look it up, published by Bantam Books way back in, first publishing 1979. But it's a very interesting read. The author, Norman Cousins, you know what, he was an editor of the Saturday Review, which is a publication of pretty learned essayists and writers. And he was editor of the Saturday Review from 1942 to 1972. 30-year job, not bad. In 1964, Norman Cousins developed an issue of the connective tissue. I don't remember what it's called. A disease of the connective tissue, which was fatal. And very, very, very painful. And the only thing the doctors had at the time for treating it were the narcotics, morphine. Well, he got on that and he couldn't stand it, so he got off. And being a rather educated man, he was also up on some of the recent history on vitamin C, which is a big time for vitamin C, a lot of it. And just to make a long story short, he was in the hospital, didn't want any more morphine, but the pain was excruciating. And so he decided to experiment himself, but also to research on the benefits of laughter. And so this is way back before tapes and DVRs and DVDs and all of that kind of stuff. In his hospital room, they brought in movie projectors with Three Stooges movies and the Marx Brothers movies and all the slapstick old movies that were just Evan Costello, all those kinds of things. And he would watch a movie and laugh so hard. And when he wrote down when he laughed and what the pain was, he could be pain-free for up to 2 hours after a good belly laugh. Huh. Now, that's why I brought this book to show you. And I don't even know if it's on library shelves anymore, but I'm sure Amazon or anyway you could get it. It's only because people like me recommend it that others are reading it, I think, in a way, because it's an older book. But a little bit of it's technical, but you get through that and you realize, it almost starts laughing yourself reading it to find out how he overcame the pain. And apparently, in not too much time, he had to leave the hospital because he was being too disrupted. Think 1964. Hospitals were quiet places, serious places. So he went to a hotel room and had home nursing in a hotel room, and they watched movies. And he wrote down all the data. Okay, so this was 1964. He had been given 6 months to live with this disease. He wrote the book 15 years later. So not only did he overcome pain, but he overcame that disease. So this is about laughter, but it's also about, he talks in here about also visiting Dr. Albert Schweitzer, who had developed a hospital in Africa for people. And Albert Schweitzer, at 90 years old, was still treating people in the hospital, and he made it through his arthritis and everything because he was a piano player. He'd get up every day and play Bach. So this talks about laughter, it talks about music, and a few other things also as ways to manage. Again, you may not cure something, but you manage yourself through these types of a thing. So I like this book and it's only, and there's a great bibliography. It's 160 pages. So it's a good one. And
we do not own it,
okay.
But it is available through Mel.
Okay.
The Michigan e-library, so other libraries in the state have it where we could get it for someone who
wants to read. Okay, good. That's good to know. It's so good to have you on board here, Megan, to look these things up for us as I'm going through. It says here it was on the New York Times bestseller list for over 40 weeks. So at the time it came out, a lot of people were reading it. And it's still a very good one. I'm sure if you wanted to buy it, I'm sure it's available also. Another book that I like it's more recent, and it's called, how do we get this? What Are Old People For? How the Elders Will Save the World, by Dr. William Thomas. And this book is about 15 years old. Yeah, it was copyrighted in 2004. But William Thomas is a geriatrician, an MD with specialty in geriatric medicine. And his book, it has some parts of it that I absolutely love for us older people, because he believes in a developmental theory of aging, which would be another webinar. But the developmental theory of aging means that we continue to develop in our older years, but in ways that are different than we have developed before. And we should never, ever dismiss the developmental attributes that we have as older people. And he will also document in there that people with Alzheimer's disease, parts of their brain are still developing. The cognitive part is not, because they can't tell you what's going on. But again, if you bring a picture book to them, they will respond, and the inner part of the brain that responds to the arts is still developing. The rhythmic part of the brain is still developing and still working. And I think I have to say this too, even people who are bedbound, the part of the brain that knows, and it's probably the gut too, the brain and the gut connection that knows when they're being treated respectfully or when they're being dismissed, they know. So people that can't talk to you, can't tell you things, can't respond with their eyes necessarily, they know when people around them are demeaning them or patronizing them, and they can't tell you, but their insides know, their emotions know. That part of the brain and the gut connection is still operating and is still developing. So they also know if you just come in and hold their hand and be at peace with them, they can be at peace also, because they know they're being respected. So the idea forever, as we age, we will always know when we're respected and when we're disrespected, even when we can't tell you, even when we don't know what day it is, we don't know what time it is, we don't know where we live, we don't know where we are. We know when we're being respected and we know when we're being disrespected. So this is all part of brain development. And some of that is in Dr. Thomas's book as well. So those are a couple of books that I think just in managing ourselves, this might give you some time to read or take a look at some of those books. Other resources, much needed now too. One is the National Suicide Prevention Lifeline. It's a number we should probably all have on our refrigerators or all have available to help other people. It is for those people who are considering taking their life, but it is also for individuals who are concerned about others who are suicidal. So if I have somebody in my family that I'm just really, really worried about, I could call the helpline and say, please help me. I don't know what to do because my nephew, my child, my so-and-so is just doing everything she can to end her life. So it's a lifeline. I like the lifeline better than helpline. It's a lifeline for those considering suicide, but also for those who are concerned about others. And then the Substance Abuse Mental Health Services Administration, which is SAMHSA. Many of us in the profession know what SAMHSA is and what they can do for us. But SAMHSA.gov has all kinds of information specific to COVID-19 concerns. But they also have a lot of virtual recovery resources and a lot of up-to-date and traditional information related to substance use and mental health issues. And I think this is interesting. There's a 24/7, 24 hours a day multilingual person available for us. And there's a disaster distress helpline right here too from SAMHSA. So these are resources, maybe, they're on a slide, but we may want them, a little more easy to get to when we find out that we need them. And a few others just locally in Macomb County. The health department has COVID-19 updates. They are still offering COVID-19 testing back there, kind of behind Martha T. Berry, behind the jail, back in that area. I think they still want you to make an appointment, but there's no charge for them. And then Macomb County Community Mental Health Access Number is available all the time for us for telephone screening and referral. There's a 24-hour crisis line available. And then the organization I work for, Care of SEM, Care of Southeastern-Michigan.com with the number there for information for classes, referrals, and recovery support. And then I put in here Alcoholics Anonymous. It might be the time for somebody to say, I've been just drinking too darn much, and where can I get help in that regard? Also at CARE of Southeastern Michigan, they have peer recovery coaches. And a peer recovery coach is available with a lot of different diseases, but in the field of substance abuse, these peer coaches are individuals who have been addicted to alcohol and or drugs, and they have at least 4 years of sobriety and working recovery programs. And so they have available, there are people available who might be able to, I sometimes say, hold your hand for a few days or hold your hand for a little bit to get you started and answer any questions. Okay, a few quickies as I'm winding down. These are helpful, and I think sometimes lists can be overwhelming, so pick one and stick with it, I think. But it does help to have a social network. Who is your social network, and can you stay in touch with them? Be optimistic, okay? So we all have times of being pessimistic. My theory on that is, okay, I'm going to be pessimistic this afternoon, but tomorrow morning when I go up, I'm going to turn the tables and I'm going to wake up optimistic. Have some kind of a belief system. Discover what your purpose is and have a purpose in life. I'm going to go back a little bit just on this purpose thing, because I have a very good friend who is a parish nurse in her church, and she does home visits, and she had done home visits for quite a number of years with one lady who then not suddenly, but she became so infirm that she could never get out of bed ever again. And she said to my friend, why isn't God taking me? I'm ready to go. Why do I have to lie here? And my friend said, well, since you are, we don't know God's answer to that. There are 2 boys in our local junior high who are having some real problems in their family and in school. And their first names are, and I don't know what they were, but say Bill and Joe. Those are their first names, and they could use your prayers. And this woman lying in bed broke into a good smile, and she said, I can do that. So her purpose now was changed very much. She still didn't want to linger too long, but as long as she was there, she could pray for Bill and Joe or whoever they were. And the next time my friend visited, she said, well, so how are Bill and Joe doing? And so they had a dialogue there. And this woman who couldn't ever get out of bed again had a bit of a purpose. And so for all of us, and as we age, our purpose will change, okay? Another bullet point is be flexible and adaptable. If nothing else, I think this COVID thing will hopefully teach us how to manage with indecisiveness or with the unknown. When it first happened in March, I thought, oh, by summer we'll be back to normal. Well, obviously no. And now we're thinking it could be another year, but we don't know. And so maybe being adaptable, being flexible is what we are challenged to be during this time. Be active mentally, physically, and socially. Stay active mentally, physically, and socially as best you can. Eat well, stay hydrated, sleep well, manage all the things, that we know and sometimes we don't want to do. And meditate, pray, take quiet time. These kinds of things can be helpful. So those are just kind of a few things that if you say, okay, today I'm going to eat better. Today I'm going to make sure I have 2 vegetables because I haven't had vegetables in a week. Something like that is part of self-management. It doesn't mean we're perfect. We never will be. And then finally, try to keep in mind that the current challenge you are in is but one chapter in your story. I kind of like that. It wasn't original with me, but I like that. You don't know how long this chapter is, but it's only one chapter. So focus on what you can control and let go of what you can't. And try to embed this chapter in your long story and accept that the ending is still unwritten. So that's it. Thank you very much for your attention. If you do have questions or if there's anything in the chat I can answer, my phone number on here is yours to call. I am not at that, but on that is my cell number. So if you call that number, want more information, that will refer you to my cell number and you can call on my cell. And do leave a voicemail if you call on my cell, because if I just get a recent number with no voicemail, I sometimes don't call back because I don't know who it is or if it's spam or whatever. Okay, so thanks, Megan, for inviting me for this, and I hope this has been helpful. If there's anything that's come up in chat, we can do that now.
Okay, yeah, thank you for being here, and thanks for all this information and just the reminder, hopefully, that this is one chapter. I like that too, one chapter in our in our novel, our
Uh-huh.
Dostoevsky novel, hopefully in length.
Yeah, yeah.
Sherry just says it was a great point about the meds interacting and maybe changing over time, get those tracked, and thank you for the information. If anybody has a question, you can throw it in the chat. We'll wait a minute or two, and then again, if you were registered, which if you showed up, you were registered, we will send you the link to this, and then feel free to share it in case there's someone you know who is a caregiver or someone who could just benefit from having some of those resources too. I don't see any other questions, so I want to thank everybody for coming. Thank you, Marcia, again, and I can't wait until we can have you in the library to discuss.
Oh, I can't either. You know, last year I attended this program in the library and made some connections with SOAR of Macomb, SOAR. You know, and just got to visit with some old friends I hadn't seen in a long time. So we all miss coming in. Maybe next year.
Maybe next year. We'll keep our fingers crossed.
Yeah. Yeah. Thank you also.
Everybody have a great rest of the day of living well with CMPL, and we'll see you at the library, or maybe we'll mail to you if that's your preference. All right.
Great.
Take care.
Thank you.